My name is Dr. Lalit Verma. I happen to be Chairman Scientific Committee of All India Ophthalmological Society. Today I am going to discuss something about effect of diabetes in the eye, specifically the retina, that is known as diabetic retinopathy. All of you are aware that diabetes is a pretty common disease. It affects nearly 72 million people in this country, meaning thereby it's a public health problem now. Even Government of India has now awakened and it has included the program of diabetic retinopathy in its five-year plan also. You see, problem in diabetes is that it's a silent disease. Lot of people are not diagnosed with these conditions and the diagnosis is pretty late. The effect, diabetes is a head to toe disease. That means it can affect any organ, right from the brain to heart to kidneys to liver to foot to nerves, and does not spare even the eye. So the effect in the eye could be redness in the eye pure, or increased chance of cataract, increased chance of glaucoma, increased chance of optic nerve problem. But the brunt of the problem or the most serious issue in this is the effect of diabetes in the retina. Remember, eye has three layers. The innermost layer is the retina, and retina is the layer from which all of us see. In case retina is not good, you don't see properly. So diabetes affects the innermost layer of the eye, that is the retina, and you must have come across some newspaper reports or some relatives of yours or some friends who do not gain vision after, say, cataract surgery. The problem of not gaining vision is because the retina is not healthy. So as I said, all of us see through the retina, and in case the image on the retina is not good, you don't see properly. So as I said, there are nearly 72 million diabetics. A quarter of them, that is nearly 25%, they have some degree of effect on the retina. So how do we help these patients? So as I said, diabetes is a silent disease. Patient may not know till the time his vision gets affected. And if the vision gets affected, it is too late for the doctor also. So the slogan is, see clearly and check yearly. So even if you don't have any complaint in the eye, if you are a diabetic, please get your retina examined. Do not go for routine eye checkups. They will not pick up retinopathy at all. So you have to go to a retina expert. He will put drops in the eye to dilate so that you can see the retina properly. And it is very, very important to get some photography done of the retina. Doctor may advise you a couple of tests, and the two common tests are angiography and the scanning of the retina. Angiography is, whenever we talk to the patient angiography, he gets scared. Angiography is not necessarily the heart. Angiography aankh ka bhi hota hai. There is a, you can inject some dye in the vein, and then doctors follow the flow of this dye in the retina. And normally this dye does not come out of the blood vessels. If the dye is leaking, that means your retina is not good, health of the blood vessels is not good. And the other test which we do is the known as scanning of the retina, or the coherence tomography or optical coherence tomography. In this, a picture of the retina or a histological section is generally made, where we can measure the thickness of the retina. Normal thickness is around 250 microns. So if there is a fluid or leakage, then this retina becomes swollen. That means the fluid will be more than 300, 400, 600. So if that is the case, that means the retina is swollen, or there is this edema or fluid collection in the retina. So then the doctor takes the decision. Today we have abundance of treatment modalities available to cure this. So there are these newer drugs which we call magical drugs, which are known as anti-VEGF drugs. So these drugs are given inside the eye, and they have the property to decrease this fluid. You see, a couple of decades back, we did not have any, we only had lasers. But now enough of literature is available, enough of scientific trials have been done, which have proven beyond doubt that if you receive injection in the eye, your vision improves, the thickness of the retina comes down, and you are able to see clearly. So the combination of information obtained on angiography and the OCT as well as your vision decides and helps the doctor to form a protocol for the treatment, that whether you require injection, whether you require lasers, or sometimes both are required. What we generally do is we give one shot, and then after 4 weeks we evaluate how much your swelling has come down, and maybe 1 or 2 more shots are required, but the effect of this injection generally lasts for 4 weeks. So doctor may call you after every 4 weeks to evaluate. Please visit the doctor regularly, otherwise this edema can come back again. The permanent cure in this condition can only happen if you keep your diabetes under control. So what I normally do is I will put a stamp on the card of the patient that blood sugar levels, blood pressure, hemoglobin, the kidney parameters, and the serum lipid profile should be under control. Remember, this disease which has an effect in the eye comes from the blood itself. So all these parameters have to be controlled. So you control the parameters, doctor takes care of the injection, lasers, or sometimes operation. And if you do this properly, believe me, you can see all through your life. So key things, as I said, control all these 5 parameters, check yearly, then see clearly. Because the thing is, if you go to a doctor when your vision is blurred, it may be too late. So the message is, even if you don't have any complaint, you are a diabetic or some of your family are diabetic, please go to a retina expert, get your retina examined, don't be impatient, because it will take 2 hours at least for a good complete checkup. Thank you so much.